Good afternoon, everyone. It's an honor to be here today, standing on the cusp of a new era in orthopedic physical therapy. Last 50 years, we relied mainly on manual measurements. We relied on individual skills and experience. Today, we are supported by a new ally, the transformative artificial intelligence combined with wearable devices. Let us start by understanding what is artificial intelligence. So, artificial intelligence refers to the simulation of human intelligence using machines, mainly computer systems. So, the ability of a machine to perform human-like tasks. We're talking about capabilities like problem solving, analyzing, decision-making, reasoning, and acting independently. So in the realm of physical therapy, AI is not just a buzzword, but it's going to really become a practical tool in the future. This is an inspirational lecture, and I see a lot of students here. I believe that 10 years from now, AI is really going to take our profession of physical therapy to a whole new level. So there are three main things that artificial intelligence can be used in physical therapy. The first thing is data analysis, analyzing data. Second thing is predicting outcomes. And the third thing, optimizing treatment plans. Those are the three main pillars that will definitely make a difference in enhancing your clinical outcomes and providing a high quality of care to your patients. So why do we need artificial intelligence in orthopedic physical therapy? There's always a lot of difficulty in predicting individual recovery timelines. So there are several challenges. For example, if you have a patient with supraspinatus tendinopathy, a mild to moderate case, it might take 6 to 8 weeks for that patient to heal. However, there are a lot of factors that come into play, and those factors a lot of times are not analyzed properly. AI can help you analyze those factors, including age, prior level of function, what kind of sports they perform, and you'll be able to predict what the individual timeline for recovery will be for that patient. There's also challenges in monitoring patients' adherence. So if you work in orthopedic physical therapy, you give your patients a home exercise program, a lot of times that a lot of patients might not be compliant with their home exercise program. However, with the innovative use of artificial intelligence, you can actually track patients' adherence to their home exercise program, and that data can be transferred to the patient's medical record for you to actually see how much your patient is adhering to the protocol you've designed for him. There's also a lack of personalized treatment plans. So a lot of physical therapists tend to want to use a cookie cutter technique. They do the same thing for each patient. And as many of you know, this is not the case. You have to tailor your treatment plan according to each patient's condition. And there's so many factors that will determine what kind of treatment plan you're going to put down for your patient. So artificial intelligence, think of yourself, if you're a doctor of physical therapy with 20 plus years of experience like myself, maybe you've seen 10,000 supraspinatus tendinopathy patients, or you've treated 50,000 patients with disc problems. But artificial intelligence is like having a team of clinical experts. It's like having thousand of people like me with the added experience. So you have basically access to a larger database that you'll be able to implement better treatment plans for your patients. There's also one of the barriers. There is limited real-time feedback in traditional therapy. So AI algorithms excel in analyzing medical imaging. This is a really important thing. This is a really important thing. This is a really important thing that those algorithms now can actually help you reading X-rays, CT scans, MRIs. It can detect faster subtle abnormalities that you might not be able to catch because AI has access to a larger database than any human being can actually possess. So there is a system called IBM Watson, which helps in identifying those subtle abnormalities in X-rays, MRIs, CT scans. So that's a very, very important tool. Artificial intelligence doesn't just diagnose. It actually helps personalize and tailor a rehabilitation program for your patients. So AI has the ability of analyzing the data for customized recovery plans, as we said, dynamic adjustments based on real-time progress. So, for example, if a patient is performing a specific exercise, there are AI tools that will recommend specific exercises based on the data you put into the AI system that will be more tailored to that patient's age, appropriate for the age, for the gender, for the level of activity, for the kind of injury that you have. Furthermore, AI-powered sensors, we call it wearable sensors. So it's basically sensors that you wear in different parts of your body. And those sensors are really revolutionizing how we understand human movement. So AI-powered sensors can really help you analyze things like gait patterns, posture, muscle activity, joint movement, range of motion, and so on and so forth. So real-time feedback is really crucial for movement correction. So this patient, for example, is performing some kind of balance or proprioceptive training, and with the sensor and the feedback he's getting from the AI, based on the data that the doctor of physical therapy has input into the system, the patient is able to perform the movement properly with the feedback he's getting from the AI based on the sensors the patient is wearing. For some of you who work on neurological rehab, and the use of robotics is definitely the ongoing thing now for the past 10 years. Now robotics are being combined with artificial intelligence in orthopedic rehabilitation. So robotic exoskeletons assist in regaining mobility. We have those devices now like the exobionics supporting spinal injury recovery. So it intelligently adjusts resistance or assistance based on the patient progress. So it's really going to do a lot of work for you. It's very hard sometimes to analyze certain things when the patient is performing a certain movement or is walking or you're doing some gait training. But with those sensors that the patient is wearing, it's going to make it much, much easier for the patient and for you as a doctor of physical therapy to get feedback on how to properly train your patient to do the right task. So this is the exobionics. We see the trunk. There is an electronic backpack. All these have sensors, femoral cuffs, knee and trunk uprights, and AFO. So each component has sensors, and it's going to give feedback through artificial intelligence to help enhance and improve the quality of care being provided to your patients. AI wearable represents a leap forward in monitoring. And we're not just talking about something like a smartwatch. We're talking about sensors that can monitor everything that your patient does, from range of motion to pain level, to muscle activity, to muscle strength. And it will alert you about any deviations from expected recovery. So if your patient is wearing those devices, you as a doctor of physical therapy will have access to any deviation, any problem with the range of motion, any problem with the muscle strength, using those sensors. And there are definitely apps syncing the data from the wearable devices into the medical records of the patient. Now, despite the benefits, the integration of artificial intelligence in physical therapy has a lot of challenges. Definitely the high cost. Right now, it costs a lot to implement such a system. But I think about cell phones. When they first came out, it was very expensive. Not everyone could afford a cell phone. I believe that over time, it's going to be more affordable. The psychological element, I think a lot of physical therapists are scared by the idea that a machine is going to actually do some of your work, and obviously some privacy concerns handling patients' data. So in conclusion, the question here, or the dilemma, is artificial intelligence going to replace physical therapists, or is it going to enhance physical therapists? I'm definitely hoping the latter. And I think that AI is likely to be a tool to assist us as doctors of physical therapy, to take the load off of us by providing data analysis and doing the hard work for us. But there are always some elements that a machine will never do. Compassion, the human touch, empathy, all of these things a machine can never do. So I don't think that artificial intelligence is going to replace us. So key takeaways: AI significantly enhances diagnosis, personalization, and monitoring, and the integration of that technology will definitely provide better patients' outcomes. And I'm hoping in the next few years we'll be able to see more of this. Thank you very much.